The African continent is working hard to procure vaccines for its citizens as COVID-19 cases are increasing. South Africa accounts for 35% of all cases in Africa. Morocco is second with 10%. Tunisia sits at 7%, with Egypt and Ethiopia each contributing another 5%. The variants have contributed to the recent increase in numbers. The Alpha variant that was detected in the United Kingdom accounts for 55% of infections in Africa. The Beta variant that was first detected in South Africa is at 53%, while the much talked about Delta variant that was detected in India is at 24%. Countries that are leading with positive cases include South Africa, Zambia, Tunisia, Namibia, and Uganda.
We are seeing that variant really aggressively taking over from other variants, not just in Uganda, but in other countries like the DRC. I was just analyzing the data a few minutes ago, and it's remarkable that within 6 weeks, that variant in DRC became a very, very predominant variant. And with that analysis is going on across several member states to understand what the situation is. As we speak, Africa CDC is hosting an important workshop in Nigeria, where we've brought together so many experts across the continent to work on and analyze and continue to generate data on the variants across the continent. One thing I omitted to mention is clearly that we are in the middle of a third wave. At least 20 countries are now fully and in the middle of their third wave across the continent, and it is a very devastating. One thing we see is that the peak of the third wave is remarkably higher than the peak of when we had the second wave.
As more than 20 countries are experiencing a third wave, even children aren't escaping the virus.
We are seeing reported cases of more severe infections in younger population, not necessarily children, compared to when this pandemic just started. So it is very possible that the new variants are having an impact, but we still need to wait and see and have real evidence that show clear association between the new variants and the infection of the younger population. This virus continues to mutate, and as it mutates, it has consequences in terms of transmissibility. It has consequences in terms of pathogenesis and the clinical outcome amongst different populations. So again, we still have a lot to learn from this virus, and that's why, I've always been extremely cautious that we celebrate what we have known about this virus, but we remain cautious.
The WHO is worried about the spread of the Delta variant.
I know that globally there is currently a lot of concern about the Delta variant, and WHO is concerned about it too. Delta is the most transmissible of the variants identified so far, has been identified in at least 85 countries, and is spreading rapidly among unvaccinated populations. As some countries ease public health and social measures, we're starting to see increases in transmission around the world. More cases means more hospitalizations, further stretching health workers and health systems, which increases the risk of death. As we have said, new variants are expected and will continue to be reported. That's what viruses do. They evolve. But we can prevent the emergence of variants by preventing transmission. It's quite simple. More transmission, more variants. Less transmission, less variants.
More research is being conducted on the efficacy of COVID-19 vaccines against the Delta variant. Sophie, Mokoena, SABC News, Johannesburg.